For making primary impressions, we should have stock trays. Stock trays are the trays which are available in the market. They are not of a particular size or shape. They come in a prefixed sizes, like we have here. These are metallic trays. These have holes in it. They are called as perforated trays. These are plastic trays. Even these have holes, so these are plastic perforated trays. These are metallic trays, but there are no perforations, no holes in these. So what is the difference in these trays? Now the plastic tray and metallic tray, the one difference is the material. This is plastic, this is metal. The other difference is, as you can see here, the plastic tray, the border of the tray is very high. This is called as the flange of the tray. This is very high. The tray is deep. But if you see in this tray, it is not that deep. It is shallow. So the trays in which the flange is high is used for patients having teeth. So they are called as dentulous trays, while the trays which are shallow are used for edentulous patients. So they are edentulous trays. Another difference between this tray and this tray is for perforations. This tray has perforation, this tray has no perforation. This is based on the type of material used. If we are using impression compound, which is a rigid impression material, we can use a non-perforated tray because impression compound sticks to the trays. But if we are using alginate, which is an elastic impression material, this material doesn't stick to the tray. So we need holes so that the material can stick to the tray mechanically. Or if we want to use a non-perforated tray, we have to apply tray adhesive for the alginate to stick to the tray. Okay, today I will tell you how to make primary impression of a cast using alginate impression material and using perforated edentulous stock trays. First and most important is we have to select the correct size of the tray. This is a tray. If you see carefully, this is the handle of the tray. On the handle you will find the size of the tray written. Like for this tray it is written U4. U means upper 4 is the size of the tray. If you see a lower tray, you will find here written as L4. L means lower, 4 is the size of the tray. The difference between maxillary and mandibular tray is, for mandibular tray there will be space for the tongue. Let's start with the maxillary tray. Hold the tray in your hand. Imagine this is a patient, this is a cast now. Keep the tray. You have to notice that the borders of the tray or the flange of the tray should go into this area. This is called as the sulcus of the tray. If you find that the tray is coming out like this, you have to use an orthodontic plier and you can bend the tray so that it fits properly into the sulcus. So now you have a tray which is fitting like this. It should cover till the end of the cast. We have a maxillary tuberosity and haemorrhoidal notch area here. It should extend till here. In the center you will see one landmark. This is labial frenum. In the tray you will find a groove. So this groove should coincide in the center and the tray should sit like this. Same way for the mandibular. Take the cast. This is the mandibular tray. Keep it in the center and put it. If you find that there is a gap here, you can take your orthodontic plier and you can just bend the tray. Okay. If you feel that tray is short, you can take a sheet of wax and apply it on the borders. There should be around 5 to 6 mm space for alginate material. So if you want to add a wax, take your wax knife. This is a wax knife. cut a thin strip of wax, cut it like this. Take your torch, this is a butane torch, make it soft. Be careful, don't burn your hands. You can take your tray and adapt it on the tray like this. So this way, if the tray is short, this wax will cover and will give extension. If any area is short, you can take some more wax sheet. Make it soft. And adapt it on the remaining border of the tray. Take your carver and cut off the excess material from inside. The wax should remain only on the borders. It should not be inside the tray, otherwise it will block all the perforations which we actually require for mechanical retention. So cut the excess. This is your tray. So this is a beaded tray. If you feel the tray is fine, you can use it directly. Same thing can be done for maxillary tray also. Okay, so now we will check it on the cast and it should fit properly. Okay, now when you are loading the material, we have to make sure that the central part of the tray should coincide with this frenum area. So you have to put the tray in such a way that it coincides here. And always remember, when we are making impression, we always load the tray posteriorly first and then press anteriorly. Why we do this? Imagine this is a patient. If we press the tray anteriorly first and then press it posteriorly, all the extra material will go into the patient's throat and then patient will start coughing. So what we do, we place the tray posteriorly first in the mouth and then press it anteriorly. So all the excess material comes out labially and then we can remove that material. So that way we can prevent coughing and gagging, which is one of the most common thing which happens if your placement is wrong or if the material is excess. Today now we will make an impression with alginate. So we have perforated trays, we have a packet of alginate. It's an irreversible elastic impression material. It comes into powder form. We have to mix it with water so we get a gel form. Now before we start the procedure, take your cast, take some water in your bowl and dip your cast in the water and leave it for 5 minutes. We do this because the cast will absorb some water and then alginate will not stick it to the cast. In the mouth there is no need, because in the mouth the patient has saliva. So alginate will not stick to the teeth or to the edentulous ridges, to the tissues. But this is a cast. So take some water in a bowl and dip it and leave it for 5 minutes. I have kept 2 casts. I have already kept it for 5 minutes. So this is your cast. I'll keep it here. This is how your cast will be. They are already wet, they have absorbed enough water. Now take this alginate and you can cut and take the powder. But the problem is these materials are kept for a long time in the boxes. So the alginate contains filler particles. Filler particles are heavy in weight. So they settle down, and if you take the material from the top, there will be less filler particles in this area. So either you can put this packet in a box fill it half and then close the lid and shake it like this. It's called as fluffing. It mixes all the particles properly. We have a packet, so we will try to fluff it in this, and we hope that the filler particles get mixed properly. This is the scoop for alginate and this is the scoop for water. They are measuring scoops. Every company gives instructions how much water and how much powder should be used to make the correct mix. So this company says we have to use 2 scoops of powder and 2 scoops of water to mix it properly. So we can take this larger one is for the powder, the smaller one is for the water. So we will take 2 powders and 2 scoops of water. Where we will take this in this bowl. What should come first? See, we have to take 2 bowls. In one bowl we take 2 scoops of water. In the other bowl we keep 2 scoops of powder ready, because the mixing time of alginate is very short. The working time is very short. For this company, if you can see here, mixing time is only 35 seconds and working time is only 1 minute 20 seconds. Imagine just 2 minutes we have for material to mix and load in the tray and put in the patient's mouth. And then setting time is just 2 minutes. So we have from this time of mixing till the setting we have only 4 minutes. So everything has to be done fast. We will take 2 scoops of water. So we have 1 scoop of water here and we have 1 scoop of water more. So we have a bowl with 2 scoops of water. And another bowl we will take 2 scoops of alginate. Okay, make sure that the bowl is dry. For the alginate there is no old plaster or alginate on the bowl. When you're using a spatula, spatula should be clean. There should not be any plaster or stone on it because it acts as an accelerator. Okay. Now we will take powder. We take powder like this. Okay. Now what you have to remember, you don't have to take so much of powder. Okay. Fill the bowl, fill the container with powder and take your spatula and just move it like this. Okay. Do not press the material. If you press the material, the material will get condensed, so you will take more powder. Okay. So take 1 bowl, another bowl. Just move the spatula like this. This is the correct level and take it. So now you have 2 bowls, 1 bowl with 2 scoops of water, other bowl with 2 scoops of powder. It should be ready like this. Do not do like this. In the water put 1 scoop, again measure and again put, because that will waste around 20 seconds. And you know the overall we have only 4 minutes to perform this procedure. So now we have everything ready. We have a spatula. Before we start mixing, you should know which cast you are going to take. Your cast and tray should be ready, because I don't want you all to mix and then search for the cast and search for the tray. If things are ready, practice how to place it. You're going to place it like this and then you're going to press it like this. Okay. How to mix alginate? You have to mix alginate in the motion of 8, or you can stroke it and press it against the bowl. Now look carefully. Take water. When you mix alginate, you have to add powder into the water. Don't do opposite. Okay? Add powder into the water and add all the powder in one shot. You have to put the powder first, wet all the alginate. So all the alginate will be wet. Once it is wet, then start your movement and then make it in the motion of 8, or you can just press it against the wall. Take your tray, load it. Take your cast, press it from behind and then press it anteriorly. In the mouth we have tissue, so we can mold the cheek. Here we don't have anything, so we have to press it slightly with the finger so that it records all the sulcus areas. So now the alginate should come out of the tray and form the retention tags. Okay. Now once you feel the material has set, how to check? Just press it like this slightly. It should not stick to your hand. The setting time is 4 minutes. By the time you will place, it will be set. Then just pull out the material and you will get an impression like this. Now all this beyond the sulcus is extra. You can take your BP handle and knife and you can cut off the extra material. Okay, do not use Lecron carver. You have to take a BP handle, attach a blade to it, and then you have to cut off the extra material until the sulcus. Okay, once you get this impression, you have to send it, you have to pour it using type 3 dental stone. Same technique has to be performed for the lower tray. Only thing is you have to take less material because the tray size is small. Mix your material, place it here, place the tray on the cast, allow it to set, take it out, cut the excess. The procedure is just the same. Once you will do it in the lab, you will understand it in a better way and we will be there to guide you.